Hi, this is Kevin McPeak, continuing the Leadership in Technology series, and I'm here today to discuss the impact of cybersecurity on patient healthcare records. What we're seeing in healthcare is massive data aggregation and voluminous data storage of healthcare records. The complete digitalization of healthcare records is the norm in these days, and this is why we're seeing such an explosion of healthcare record breaches. It's extremely important to control the encryption of healthcare records to render stolen healthcare records as worthless. To do this and to do other cyber practitioner activities within the healthcare industry requires talented cyber professionals to be hired and to be employed within the healthcare industry. And the purpose of these types of employees is to ferret out APT systems, command and control, and side channel malware that could be deployed at different nodes across the hospital infrastructure. If you think about some of the specific risks, even to patient safety and the potential for lives to be lost, things that are digitized, sort of like the Internet of Things within healthcare, things around, for example, fusion pumps, things around drip rates, all these things impact the overall health of the patients. Also, if you think about the potential for a terrorist event and how the secondary and tertiary effects of healthcare cyber. I'll give you an example. When there was the Boston Marathon bombing, a lot of people that were injured were immediately taken to a hospital. In a worst case scenario, if that event had been preceded by, let's say, 6 hours prior, if there had been a hack into the local hospitals, into the refrigeration systems that kept the blood supplies refrigerated, the blood could have been thawed out. It would have been, blood that could not have been used properly, wouldn't have been available for those that were injured. So these are kind of the concerns around healthcare and sort of the computer systems involved in various components of hospital healthcare. But when you think about it, healthcare is actually the easiest industry out there in order to social engineer. And that's because there's a culture within the medical profession to be helpful. So, things are moving quickly, and the only time patients are really in the hospital is because they have a medical crisis. There's something they need to get done, something's wrong with their body. So people aren't thinking about defenses of IT systems or of their privacy or that sort of thing. They're thinking of how can we share information to best help those that are sick and needy. Also, within the healthcare profession, as you rise through the ranks in the hospital structure, the types of great leadership hospitals have, but what happens is those types of healthcare executives, they're not necessarily cyber savvy. They're not brought up in that sort of cyber mindset. So a lot of times what happens is hospitals will spend millions of dollars to secure and lock down the core databases that have the healthcare patient records and things of that nature. But when you also think about it, a lot of healthcare records are in forms that get filled out and then get scanned into systems, PDF documents, Word documents, spreadsheets, things of that nature. So you really have to, if you're in the healthcare industry and you're worried about cyber, you really have to look at how you're doing business. You have to think about things like your downstream hospital partners, things like external labs, your consultants, your hospital partners and staff, things specific to your healthcare electronic medical records, and things that get auto-blasted out to the various insurance companies and the payment systems that are out there. And all of that involves data in motion. So there's data that's collected and aggregated in the hospital infrastructure that then auto-blasted and pumped out to all these various downstream partners and providers. Also things specific to encryption on RFID devices. This is a very important consideration. And these are types of devices that, for example, they might have low energy power systems. They might have limited processing capabilities, and they might require lightweight cryptographic algorithms in order to function. So really what's needed is a way to incentivize hospital personnel at each level to do the right things, because it really does rely on not just technical systems, but on user training and best practices. One thing that I've seen recommended is to, every time a member of a healthcare staff receives an email or some type of a text message, if it seems like it's a social engineering attempt, is for them to actually report it to the help desk as a potential social engineering attempt. And in that type of scenario, you actually want to incentivize them so that they maybe get like a $500 reward if they do that type of reporting. And you could actually have live fire exercises where you execute that and then pay out those awards so that everybody kind of keeps them on their toes. So again, these are just a few of the thoughts around cybersecurity within healthcare. So just would like you to really consider those things, especially if you work in this field. mission first, people always. Thank you.